Hello everyone. Topic for today is a heat stroke. As we can all see, the heat is taking a toll, and every summer we have a high spike of temperatures. And this summer is also not kinder, but the most probable dangerous cause of the heat as a health may be the heat stroke. But before we go to the heat stroke, we should see what the mechanism of body is to control the heat. Mostly our body can control the temperatures if we go to the slightly hot weather by sweating mechanism. As we are in the hot weather, we start sweating, and by the breeze or wind, the temperature is controlled by our hypothalamus. But as the temperature rises, our body gets heat exhaustion. So most commonly we get starting with the heat cramps. As we see in a lot of sports or people in the outside activity, they had a severe cramps in their legs, feet, body. So it's the early part of the heat stroke. Somebody is getting frequent heat cramps, especially when he's outside. He should take plenty of water and fluids. So that's an early sign that that person can be exposed to the heat stroke. Second part is we may also get a lot of heat rashes. That's the early part of the heat stroke. But if we continue to get exposed in high heat, then we may be exposed to the heat stroke. Heat stroke in which the temperature of core body temperature goes beyond 105, 106 degree. So it's a very high temperature, and that our body is unable to handle the temperature of controlling mechanism. Our body, as I earlier told, is well equipped by the hypothalamus to control the temperatures of our body by cooling mechanism. It usually occurs when we are exposed to long hours in the heat. One exposure is those who are working in the hot areas for a long time, and others who are not used to going in the hot areas, especially small children and elderly are of high risk. But everybody is capable of getting the heat stroke if he doesn't take care. Heat stroke is a very critical thing, and we have to take a lot of precautions. First precaution would be to avoid being exposed to heat in long time, especially when the temperatures are very, very high in the mid-afternoon or evening. Second, we should also take a lot of hydration in form of fluids, not only salts, but fluids should be rich in potassium and chloride and other electrolytes. Commonly is an ORS or some soups. Our Indian meals are also enriched with a lot of salt. So if you have a proper food along with adequate intake of water, that also helps us to help in dehydration. But for long exposure in the heat, we all are prone to the heat stroke. Once a person starts feeling headache, dizziness, and weakness, and a lot of cramps, he could be in some sort of early heat stroke. At that time, a medical attention or precautions can help him to not to go to the heat stroke in the extreme phase. Because in extreme heat stroke, the body gets above 106 degree, the body cooling mechanism fails, patient is hyperthermic, and at the same time we have to make an immediate medical attention to the person. If in and around you are in the house or anywhere else you see any person who is having this very high temperature, we can immediately take him to the cooler place. If he's awake and conscious, then make him drink fluids. Cold sponging is an emergency thing that you can do at home also till you reach to the hospital. But heat stroke is an emergency. As soon as you can reach to the hospital, it's better. Till then, we can cool the person who is having a suspected heat stroke by measuring the temperatures. I will also suggest that during this summers, we avoid going to the hot area for long time. As already I told you, along with a lot of fluids. We are the warm-blooded animals and mammals which can control our body temperature very well. But extreme heat can take a toll on us. Heat stroke is more dangerous to those who are cardiac patients, who are having renal problems, who are diabetic, elderly. So these patients should take extra precaution of hydration. They should drink plenty of water and not miss the meal. So besides the heat stroke, the person may get heat cramps and dizziness. You may feel that he is having the dizziness, vertigo, his body will start aching. I will also like to add to this that this temperature which you're talking about is not the normal mercury thermometer that we see. It's a core body temperature, which is a little different from the normal temperature. So sometimes people get biased by the home digital thermometer. So you don't get panicked by the home digital thermometer. But if you're suspected, you bring the patient to the hospital and get him checked. The other part of the heat stroke is how much we are able to take control of our blood pressure. The blood pressure should not fall down. For that, we should continue to have plenty of electrolytes, coconut water and curd with salt. These are the things that we should include amply unless until contradicted the kidney patients. Most important part is the cooling. Once the patient comes in the hospital, the patient is cooled by ice packs, by ice cold water and giving cold IV fluids. After giving that, we give him the IV fluids and take care of his vitals. There are other conditions also associated with the heat stroke, that is rhabdomyolysis, in where the muscles start breaking down and they cause a kidney failure. The cooling mechanism stops, patient starts having dizziness and he starts having fainting episodes. And at that time, we have to be alert. The early part of prevention is the best cure, we say. When we feel that we are having the heat cramps or heat early signs, that is the time we have to act. We have to not to wait for the heat stroke to strike us. Once the heat stroke strikes up, then it is very critical stage. So any fundamental signs that you see, like dizziness, body ache, headaches, high temperature, we have to act. But at the same time, we say every fever is also not a heat stroke. It could be viral, it could be urine infection. So we also have to look for how high the temperature is. So if the patient is suffering from fever, you should not say that it is got a heat stroke. You should look for the alternative diagnosis and visit to a physician to look forward for it. Most of the times, the heat stroke patients are the persons, as I already said, are exposed for a long exposure. But even nowadays, as our temperature, we are in, most of the people are in air conditioning or coolers. So if they miss that or they are in the outside for a long time, they should keep a very thin. As we normally drink a lot of water, we start sweating. And that sweating mechanism when fails, that is a very dangerous point. So I would request all of you to take care this summer. Be hydrated, take a lot of water, have ample of diet which is rich in proteins and salt. Don't expose yourself to long heat hours. Avoid the peak temperatures and stay healthy. And if you have any issues, visit your nearest hospital. The treatment for this is available and you will be taken good care. Thank you very much.